Okay, great. So I want to thank everybody. Thank you, Regis HR, and all of you for joining. This is, I think, number 12 throughout this whole, since COVID began, 11 or 12 presentations we've done with you all in Regis. And thank you again for the opportunity. Obviously, I always commend Regis, the entire Regis HR team, George and Carlos, and the entire team for hosting these webinars. They're always productive and informative, and we truly hope all of you get a lot out of this. I'm here today with my partner, Joseph Ruiz.
Hello.
And we both thank you for allowing us to present today. So what we're going to do today is—
Carlos, I'm sorry, sorry to interrupt, but just one more thing I forgot to mention to everybody, of course, as if you've been a part of the calls before, you know this, but as they're going through the presentation, if you want to post your questions to the chat room, we will go ahead and at the end of the presentation address all the questions that are in the chat room. And then that way we can get to all your questions. So whenever they come up, just post them in the chat room and we'll get to them at the end.
All righty, great. So we're going to talk today about COVID-19 and employer issues. A lot of issues that have popped up historically have dealt with, in the last several weeks, we'll say, have dealt with vaccinations and whether or not employers, for instance, can mandate them. What are pitfalls that employers need to be mindful of and be careful not to fall into as this COVID-19 progresses and takes a different shape and causes a new wrinkle in employer-employee issues. So that's what we're going to focus on today: COVID-19, vaccination, and return to work. So we're going to divide this up into 4 parts. We're going to start real briefly in the beginning with the COVID-19 updates. We're going to then segue into CDC updates. And what this is going to focus on are vaccinations and how to deal with employee-employer issues in connection thereto. And then we're going to deal in part 3 with some miscellaneous vaccination and return to work issues. At the end of this, we'll sure there'll be questions. So we'll open it up on part 4 for question and answers and do our best to get them all answered for you. Let's get right into it. So as we all know, we are a year and a half into the COVID-19 pandemic, and things have not returned to normal. As you know, the Delta variant has caused a spread of COVID-19 across the country, including in Florida, and a lot of employer-employee issues have arisen as a result of the impact of COVID-19's continuous impact. Case counts, deaths, and hospitalizations have risen rapidly for the first time since the vaccine became widely available. As you know, currently there are 3 very popular vaccines being used in the United States, among others that have been developed. And in the meantime, these 3 vaccines have not yet fully managed the spread of COVID-19 for a variety of reasons. Not everybody's vaccinated. And in addition to that, the Delta variant has broken through some of the vaccine's effects.
And this newest surge, sometimes it's the 2nd, 3rd, 4th surge in some areas, and it's really caught employers kind of off guard. And just as we all thought we were getting out of this, seems like we're falling right back into it. And some things have changed and frankly regressed. So we're going to talk about those issues.
Yeah, records throughout the country have been surpassed as a result of the COVID-19 surge. So as you know, the Delta variant is causing a lot of problems. It's more contagious. It's believed to be responsible for a majority of the cases in the US. Public officials are renewing their push to get people vaccinated. Various jurisdictions have amended their restrictions to combat the latest wave. So it's no wonder that employers are trying to take a more aggressive approach. This will segue into this presentation about what rights and specific criteria can employers implement or mandate, which we'll talk about, to try and control the spread amongst its work environment. So the CDC and the Department of Labor have issued additional guidance and recommendations, and this presentation is based on that guidance and recommendations.
And some of the guidance and recommendations has been around for a little while, but we're obviously gonna highlight it again, based on this newest surge. Things are changing, and some of the things like the updated mask mandates feel like they're new, and they're changed from previous guidance that was issued a few months back, but conditions are changing.
And as you'll see also, in addition to the CDC and the EEOC, Department of Labor, the states have also issued new restrictions and mandates and specific criteria. Let's get into some CDC updates. So on July 27th, not too long ago, the CDC officially updated its guidance on masking. Previously, if you were fully vaccinated, you could participate in many of the activities that you did before the pandemic. However, things have changed. The CDC has changed its guidance. which had previously stated that vaccinated people did not need to wear masks indoors. As you know, that guidance has changed.
Yeah, and that was kind of the big ticket item, frankly, of this latest CDC guidance, where it seems like we're going backwards, basically. We are getting worse, the pandemic is getting worse, and the CDC decided to update. Well, before they threw this out as a carrot, they said, hey, if you're vaccinated, you can stop basically wearing a mask pretty much anywhere. Now they've backtracked and said, you know what? Things are changing. The Delta variant appears to be a lot more catchy. So therefore, as an abundance of caution, if you're in an area of substantial or high transmission, which is a huge part of the country, you should wear masks in public places indoors.
Every county in Florida is an area of substantial risk or high risk. So consider Florida in that category.
Yeah, and the majority of the country, frankly, is in one of those two categories.
Right.
They can update that fairly regularly, but effectively, the grand majority of the country is in one of those two categories at this time.
So the guidance is wear a mask, whether you're even if you're indoors, wear a mask. It's required. Where required by laws, rules, regulations, or other local guidance. And like Joe said, if you're in a high area with substantial risk of high transmission, wear a mask. And it's important, especially if you have a weakened immune system. And a lot of employees will complain about that, and we'll get into that in a second. If you have a weakened immune system, wear a mask, or because of your age or an underlying medical condition, you are increased risk of severe disease. CDC is recommending wear a mask. And if someone in your household has a weakened immune system, is at an increased risk of severe disease, or is unvaccinated, again, recommendation, wear a mask.
And this new guidance, is based on basically for vaccinated people. They gave that as a carrot before that, hey, if you're vaccinated, you can take off that mask. Unfortunately now, because the Delta variant seems so catchy, they're saying, you know what, we're taking that back. Even if you're vaccinated, unvaccinated, you're still recommended to wear a mask either way in public places. But even if you're unvaccinated, you should wear a mask in those indoor public places.
So let's talk a little bit about some of the differences. You've probably heard the terminology quarantine. Quarantine, and you've also heard the terminology isolation. There's a difference between the two. You quarantine when you might have been exposed to the virus. You isolate when you have been infected with the virus, even if you don't have symptoms.
And we all learned a lot about this earlier in the pandemic, what to do if you've been exposed. But with the new surge, they're basically reiterating this guidance and even amending it somewhat, even if you're fully vaccinated. So there have been some changes. This is, quarantine and isolation, something we all learned a year and a half ago, frankly. But they have to reiterate that now that cases are spreading like wildfire.
So quarantine if you have been in close contact. And you remember this from many, many months ago when the CDC came out with this, within 6 feet of someone for a cumulative total of 15 minutes or more over a 24-hour period. That's when you've been in close contact. And it's with someone who has COVID-19, unless you have been fully vaccinated. We'll get into some of the nuances. So what to do? In quarantine, you stay home for 14 days after your last contact with a person who has COVID-19. Watch for fever, which is 100.4 Fahrenheit, cough, shortness of breath, or other symptoms of COVID-19. If possible, stay away from people you live with, especially who are at high risk of getting very sick from COVID-19. Of course, if you have symptoms, immediately self-isolate and contact your public health authority or healthcare provider.
And remember, quarantine is if you had contact with somebody that has it. Isolation is once you have it, you switch over into isolation.
Now, people who are fully vaccinated do not need to quarantine after contact with someone who had COVID-19 unless they have symptoms. This is guidance that's been provided. However, fully vaccinated people should get tested 3 to 5 days after their exposure, even though they do not have symptoms, and wear a mask indoors in public for 14 days following exposure or until their test result is negative. So you can see that the vaccination adds another layer of analysis that the CDC has come out.
Yeah, and this is part of the updated guidance. Before, there was very few breakthrough infections. The amount of breakthrough infections, which is if you get infected, even if you have been vaccinated, it's called a breakthrough infection. And the amount of breakthrough infections has started to climb.
Yeah.
And so this is part of that additional protections that the CDC is recommending. even if you're vaccinated.
Let's go to isolation. When to isolate? As you know, it's used to separate people infected with COVID-19 from those who are not infected. People who are in isolation should stay home until it's safe for them to be around others. Monitor your symptoms. So it's important to go through what the criteria is about taking proactive measures to prevent the spread. Monitor your symptoms. If you have an emergency warning sign, trouble breathing is a big factor. That historically has been a telltale sign of COVID. Seek emergency medical care immediately. Stay in a separate room from other household members and use a separate bathroom as possible. Avoid contact with other members of the household and pets. Don't share personal household items like cups, towels, and utensils, and wear a mask when around other people if you're able. So how to assess? Now this is post-vaccination signs and symptoms involving employees. Now we wanted to get you first through some basic guidance that the CDC says to deal with on an individual level. Now you're dealing with it at the employee level. We're going to start with post-vaccination signs for those that have been vaccinated and symptoms in employees. What happens if employees start showing symptoms?
Yeah, and basically, once a person has been vaccinated, sometimes they have symptoms shortly after vaccination. And we're talking about chills is a common one, fatigue, things like that, that may be basically a byproduct of getting the vaccine, but sometimes can resemble COVID-like symptoms. So, hey, what do we do when an employee feels a little bad after getting the vaccine? The question is, could they have COVID? Yes, it's possible, but how do we handle that? So basically the CDC has said, hey, if you have regular vaccine type side effects, again, we're talking about maybe fatigue, chills, things of that nature. If you have those typical post-vaccination symptoms, and you can go back to work if you feel well enough, do not have a fever, and do not have other signs and symptoms of COVID-19, cough, shortness of breath, sore throat, or change in your smell or taste. You shouldn't get that from a vaccine. That it's very likely it's COVID. Now, if your symptoms last longer than 2 days, hey, it may be COVID-19. It may be time to change it up and send them back home. But if it's regular symptoms, basically monitor it, make sure they don't have a fever, make sure you don't develop any other symptoms, and you can still return to work. Now, conversely, if you have non-typical symptoms from vaccine, things that are COVID-19, again, cough, shortness of breath, sore throat, loss of taste or smell. Those are things that say, hey, this is probably not a vaccine side effect. This is probably COVID. In that case, those people should be probably sent home and sent to either quarantine or isolation, and should be sent to test, frankly, to figure out what's going on for their protection and for the protection of all the others in the workplace.
That's right. Now, for employees with not typical vaccination, post-vaccination symptoms, exclude from work pending evaluation by a healthcare provider for potential causes. So when the criteria for return to work depends on the suspected or confirmed diagnosis. So you will, and you may, as a result of the Delta variant, start seeing non-typical post-vaccination symptoms. So it's important for them to be sent to get evaluated. Employees with confirmed, like Joe said, or suspected COVID-19 should isolate at home, follow CDC recommended steps, and not return to work until they meet criteria to discontinue home isolation or return to work if healthcare professional in consultation with healthcare providers. Earlier in this presentation, we went through some of those recommended steps when you're dealing with isolation and quarantine. Unvaccinated workplace contacts should be notified and advised to quarantine and self-monitor for symptoms. Now, it's important that they be notified, but it's also important that you maintain the recommended confidentiality. You don't need to give employee names. You don't need to give those kind of, a lot of people in the beginning of when COVID first 19 came out, it was one of our earliest presentations. You talked about how to notify your co-employees and co-workers. Keep information confidential, and you can do it in an anonymous fashion. Okay, let's move on to part 3. These are vaccinations and return to work. We're now getting into the heart, the meat and potatoes of employer-related issues with vaccinations and return to work as a result of COVID.
And this has become a big issue now. A lot of bigger employers are now saying, hey, we're gonna require vaccines for you all to come back to work, or to come back to the office. The news is, full of big employers that have decided to take these steps. Furthermore, hospitals and now possibly the military is gonna require vaccination. So it's a growing trend, in part because of this Delta variant being so catchy that basically it's expanding greater than we thought it would originally. But these vaccine requirements from employers are happening, and they're likely to be happening more and more.
So can an employer require that employees who physically enter the workplace be vaccinated for COVID-19? One of the biggest questions that are in the media right now. The answer is yes, with caveats. The EEO law, the federal EEO laws do not prevent an employer from requiring our employees that physically enter the workplace to be vaccinated for COVID-19, subject to, however, reasonable accommodation provisions of Title VII and the ADA and other EEO considerations, which we're going to get into now. Note that Florida follows federal law on these issues, on issues concerning Title VII, ADA, and EOC considerations.
Yeah, and Title VII, for those of you that don't know, is the standard anti-discrimination laws that protect against gender, race, ethnicity, things of that nature.
Discrimination, right?
And then the ADA protects for individuals with disabilities, protects them from any kind of retaliation or discrimination against them.
Right.
So they're very all-encompassing discrimination laws that are, that have been around for a long time, but they have special application now in COVID times.
Okay. So in some circumstances, let's talk about some important considerations. In some circumstances, Title VII, let's talk about them as anti-discrimination statutes, the laws, and the ADA require an employer to provide reasonable accommodations for those that have a disability, or, and you may have heard about this also as a big issue that's arising, sincerely held religious belief, practice, or observance, and that they do not get vaccinated because of that for COVID-19. So you need to provide a reasonable accommodation to those that do not get vaccinated if they have a disability or a sincere belief, religious belief. Now, unless providing that accommodation would pose an undue hardship on the operation of the employer's business, which we're going to get into that in a second. The analysis for undue hardship depends on whether the accommodation is for a disability, including pregnancy-related conditions that constitute a disability, or for religion. The employers that have a vaccine requirement, you may end up having to respond to allegations that the requirement has a disparate impact on employees based on race, color, religion, sex, or national origin, basically protected classes under Title VII. Age, under the Age Discrimination in Employment Act, which is 40 plus. So in short, when you apply a vaccine requirement, if you decide to apply it as an employer, you need to be aware of not applying it in a manner that's disparate. And that comes across the board with a lot of employer decisions that you need to be careful of, is the way in which you do it. If you do it in a fashion that targets a protected class, that can lead to a disparate impact or disparate treatment claim.
And a simple way to imagine that is if you have, for example, a workforce that was, the line workers were basically mostly Hispanic, while the management was mostly, let's say, white, and you had a rule that all line workers had to be vaccinated, but none of the managers had to be vaccinated. It can come off as a disparate impact because, let's say, 95% of the people that had to be vaccinated were Hispanic, while everybody else didn't have to be vaccinated. So that is an example of a disparate impact. Even though the policy doesn't say anything about Hispanic people have to be vaccinated or vice versa, the Caucasians didn't have to be vaccinated, it has an impact on a specific class that is different from other classes. So that is an example of, although it's race neutral, the policy itself, it may have a disparate impact and could lead to allegations, at least, of discrimination.
So it's important that when you implement this, there not be any claims of disparate impact, and that there be legit non-discriminatory reasons for implementing. Okay, Governor DeSantis in Florida just recently just a couple months ago, signed an executive order 2181 prohibiting the so-called vaccine passports, meaning requiring an official document to certify that an individual has been vaccinated. Now, the law says that business entities cannot require, this is an important distinction, patrons or customers, that patrons or customers provide documentation certifying that they've received COVID-19 vaccine. You can't require patrons or customers for a vaccine passport or certifying that they've recovered from the virus to enter or receive a service from the business. However, the law does not prohibit private employers from requiring that their employees show proof of vaccination. So that's a big distinction between patrons and customers and employers requiring employees to actually be vaccinated.
And it doesn't appear like that is going to change anytime soon. The governor's been pretty silent as to
Right.
employees and the way that the law is crafted. It is specifically customers or patrons. So it doesn't appear that that is going to change at all. But we've had lots of businesses call us and say, hey, I thought I'm not allowed to ask about vaccine status. That is not the case. For your employees, you are allowed to ask, you are allowed to require, you are allowed to do all these things that we've talked about. That governor's order only applies to basically customers, people who walk through the door.
So may an employer require COVID-19 vaccinations for all employees entering the workplace, even though it knows that someone may not get a vaccine because of a disability? The answer is yes, provided certain requirements are met. Under the ADA, an employer may require an individual with a disability to meet a qualification standard applied to all employees, such as safety-related standard requiring COVID-19 vaccination. Now, this is the key. If the standard is job-related and consistent with business necessity. So this is where you could get a lot of disputes with employees as to whether, in fact, if they try and go down, an employer goes down this path, is it job-related, consistent with business necessity? Let's talk about a direct threat. If an employee cannot meet the standard because of a disability, the employer may actually require compliance unless it can demonstrate that the individual will pose a direct threat to the health or safety of the employee or others in the workplace. So you may have a different business set up in a way that a direct threat is a real possibility compared to another business where maybe the employees are in an office setting and they're much farther apart from each other, and it's very difficult to justify a direct threat. Direct threat is a significant risk of substantial harm that you cannot eliminate or reduce by a reasonable accommodation. 2 steps in determining this. Determining if there's a direct threat, and if there is, assessing whether a reasonable accommodation would reduce or eliminate the threat.
Yeah, and the EOC, quite some time ago already said, hey, if you have COVID, you are a direct threat.
That's right.
So you don't have to do that analysis for people who actually have COVID. Who we're talking about right now is people who are unvaccinated and for some disability-related reason cannot get the vaccination or do not want to get the vaccination. Again, this is strictly an ADA analysis. This is not anybody who does not have a disability that we're talking about. This is the people who say, hey, because of my disability, I cannot get the vaccine. And the question we're now asking is, hey, can we let them back in the workforce? The answer is, if they're a direct threat, you do not have to let them back in the building.
So let's talk about if an employee who's not vaccinated due to disability poses a direct threat, what must the employer do? Make an individualized assessment of the employee's present ability to safely perform the essential functions of the job. What goes into that assessment? Here are 4 factors that we've been providing guidance under this ADA analysis. The duration of the risk, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. So you could see that even though there's some wiggle room for employers, you can see how employees can start, if they feel that they're being discriminated against or their rights have been violated, are going to try and establish that these factors were never met. So it's important to document and establish that you did this analysis as an employer if you're going to go down this path.
And this is the typical analysis you're supposed to do with pretty much any disability inquiry, except direct threat obviously is kind of a new issue dealing more with COVID now than it was before, because before most ADA analysis, it didn't appear that the employee was ever going to be a direct threat because of their disability. But now the chance is that their disability does not let them get the vaccine, which may make them more susceptible to COVID and could spread that to others. So the direct threat is actually always been part of the ADA analysis, but COVID has really shown a spotlight on it.
So in assessing this direct threat, also take into account the type of work environment. Now, here are some factors to think about as an employer. Whether the employee works alone or with others, or works inside or outside, how is the available ventilation, the frequency and duration of indirect interaction they typically will have with other employees, the number of partially or vaccinated individuals already in the workplace, whether other employees are wearing masks or undergoing routine screening testing, and the space available for social distancing. So you can see how this is a very specific case-by-case assessment for employers. Now, if the assessment demonstrates that an employee with a disability who is not vaccinated would pose this direct threat to themselves or to others, then the employer must consider whether providing a reasonable accommodation would reduce or eliminate that threat. This is the next problem. Potential reasonable accommodations could include requiring the employee to wear a mask, a staggered shift work schedule, making changes in the work environment, such as improving ventilation systems, or limiting contact with other employees and non-employees, permitting telework, remote work environments if possible, if feasible, or reassigning the employee to a vacant position in a different workspace. So the assessment, and this is dealing with individuals who are unvaccinated and have a disability, unreasonably accommodating has multiple factors you should consider as an employer. Now let's go into Title VII analysis, and this is an important one that is appearing a lot, and that is religious beliefs. How should, as an employer, respond to an employee who communicates that he or she is unable to be vaccinated for COVID-19 or provide documentation or other confirmation of vaccination because of a sincerely held religious belief, practice, or observance? So with religious belief, once you're on notice that an employee's sincerely held religious belief, practice, or observance prevents that employee from getting a vaccine, the employer must provide a reasonable accommodation unless it would pose an undue hardship. So it's a very broad standard. However, now there is guidance in the EEOC that explains the following. The definition of religion is broad and protects beliefs, practices, and observances with which the employer may be unfamiliar. The employer should ordinarily assume that the employee's request for religious accommodation is based on a sincerely held religious belief, practice, or observance. So that begs the question, what happens if the employer doubts? If an employee requests a religious accommodation and the employer is aware of facts that provide an objective basis for questioning either the religious nature or the sincerity of a particular belief, practice, or observance, then at that point, the employer would be justified in requesting additional supporting information. So this is an interesting area, and it can get tricky because the question becomes, does the employer in fact have that objective basis or not? Or are they targeting this employee, thereby giving rise to a potential Title VII related claim?
Yeah, and it's worthwhile to note that many of the major religions, frankly, do not have a particular set of beliefs that say, hey, you cannot be vaccinated. Employees may basically claim, and that may give you an objective basis to say, hey, we know that Catholics aren't anti-vaccine because they're Catholics. There may be Catholics that are, against vaccinations. That is not part of the sincerely held beliefs. So there is a lot of basically undefined wiggle room there. You are supposed to treat it as being true. Now, again, if it's a small religious sect that you don't have much information on, it may be worthwhile to ask for additional information, but generally it's supposed to be treated as true, that yes, you're basically supposed to take their word for it. It does create a lot of gray area, and I'm sorry we can't give you more on that, but that's the center and how it goes. You shouldn't really ask for more information unless you have an objective reason to think that it's not a sincerely held belief.
So when you're dealing with a sincerely held reasonable belief, under this Title VII, you as an employer should thoroughly consider all possible reasonable accommodations. We went through this analysis on the disability side, now on ADA, now we're talking about Title VII accommodation. It includes telework and reassignment. Under Title VII, courts define undue hardship as having more than a minimal cost or burden on the employer. This is an easier standard for employers to meet than the ADA's undue hardship standard that we mentioned earlier.
Yeah, and again, undue hardship is, hey, even if they have this disability, or even if they have this religious belief that they can't do this, how much are you as an employer required to do to try and accommodate them? The undue hardship standard in Title VII is actually a lot lower, so you don't really have to do a lot. You can do basically a small amount or a minimum amount. You don't have to change your entire operations. While if this was an ADA matter, it could be a lot higher standard. You may have to make a lot more investment or some other changes to your workforce to accommodate them, while under the religious exemptions, you do not have to go as far.
So considerations dealing with undue hardship, they include, and this is non-exclusive list, the proportion of employees already vaccinated against COVID-19, the extent of employee contact with non-employees whose vaccination status could be unknown or who may be ineligible for the vaccine. Ultimately, if the employee cannot be accommodated, then you as an employer should determine if any other rights apply in the EEO laws or other federal, state, and local authorities before taking adverse employee action against an unvaccinated employee. As you all may know, consult with HR, consult with your legal counsel to see what the risk exposure is. Let's go into Title VII analysis. Now we're going to continue with this analysis, but focus on pregnancy analysis. Under Title VII, what should an employer do if an employee chooses not to receive a COVID-19 vaccination due to pregnancy? A question that's coming up more and more. If an employee seeks an exemption from a vaccine requirement due to pregnancy, the employer must ensure that the employee is not being discriminated against compared to other employees similar in their ability or ability to work. This segues into similar arguments that we spoke about earlier that Joe and I went into when you're dealing with disparate impact or disparate treatment with other employees. Is this pregnant individual being targeted compared to other employees?
And pregnancy is covered possibly as a disability and possibly as a Title VII. So it's a little bit of a blend of both. So it's important to work with pregnant employees because they are one of the most well-known, I guess, groups that may be subject to, hey, not getting the COVID-19 vaccine at the time that they are pregnant.
So a pregnant employee may be entitled to job modifications in this scenario, including telework, changes to work schedules or assignments, and leave to the extent such modifications are provided for their employees who are similar in their ability or inability to work. Remember, not creating a disparate impact or disparate treatment argument.
And remember, any accommodations you make, they can depend on the job. For example, you may not have to make many accommodations for a laborer who is a gardener and takes care of the outside of the property and doesn't really have any interaction with other individuals. They basically may not need any accommodation if they are unvaccinated due to either Title VII or ADA reason. So they may not really need a modification or any kind of accommodation. But if they are working in a small environment with many other people around them, those people are the ones that are really going to have to create some kind of individualized assessment as to how we can accommodate them or if we can accommodate them at all.
So now we're going to wrap up this area, reasonable accommodations. This is dealing with employees who are not vaccinated, even though there's an employer mandate, let's say, but they're not vaccinated due to, we've gone through disability covered by the ADA, or a sincerely held religious belief, practice, or observance covered by Title VII. They may be entitled to reasonable accommodation that does not pose an undue hardship on the operation of the employer's business. Examples: reasonable accommodation of an unvaccinated employee entering the workplace might be to require that they wear a face mask. They work at social distance from coworkers or non-employees. They work a modified shift. They get periodic tests for COVID-19. They be given the opportunity to telework, or finally accept a reassignment. So there's quite a bit of guidance out there as to reasonable accommodations. Now, go ahead, Joe.
Yeah, and we've seen one of those examples is hey, either you are going to get vaccinated or we're going to start testing you weekly. A lot of the hospitals and healthcare facilities have basically gone down that path. So that is one of the proposed accommodations, and one of the ways to allow these people back into workforce, even if they can't get vaccinated due to either of those reasons.
Major issue: proof of vaccination. We're switching now into a different topic. Requiring employees to provide proof of vaccination. If an employer requires them to provide proof of vaccination that they have received a COVID-19 vaccination from a pharmacy or other healthcare provider, the employer cannot mandate that the employee provide any medical information as part of the proof. It is not prohibited, though, to request basic vaccination card proof which does not contain medical information. However, you may not want to maintain a copy of the card to avoid safety record keeping obligations. So you can ask them to provide proof, but not necessarily, not a good practice to keep the actual record itself. So what you might want to do as an employer is to create a confidential tracking document that just has the employee name, maybe a list of an ID number, the type of vaccine shot received, and the date of the last dose of the vaccine. Keep it simple. Don't ask for the cards, don't ask for copies, etc. Let the employee know that they do not need to provide any medical or family history information, and do not ask for reasons for vaccination or how they have handled the vaccine dosage, including the second more difficult dose that you all know accompanies the Pfizer and Moderna vaccines. Okay, moving on. Is asking, requiring an employee to show proof of receipt of a COVID-19 vaccination a disability-related inquiry?
Yeah, and that is something that is kind of highly regulated. You don't want to basically ask somebody if they're disabled if they have not asked for any accommodation or asked anything of that nature. So you want to be careful about that in general. And that is disability-related inquiries. And that's been a thing in the workplace for a long time. But there was a question that, hey, if I'm asking if they're vaccinated, is that a disability-related inquiry? And does that come with all the problems that disability-related inquiries have? And so basically the EOC has said, no, it is not a disability-related inquiry. Simply asking if they have been vaccinated. You do not ask them why they've been vaccinated, how they've been vaccinated, if there was a reason why they were vaccinated. You keep all that. You are simply requesting proof of receipt of COVID-19 vaccine, and that in and of itself is not likely to elicit information about a disability, and therefore not a disability-related inquiry.
Yeah, avoiding the need to invoke the ADA standard that they be job-related and consistent with business necessity. Like Joe says, stay away from those more in-depth questions. What to do when an employee informs an employer that they're not getting the COVID vaccine because of a disability? So they advise you that they have a disability. What do you do next? Well, to request an accommodation, an individual does not need to mention the ADA or use the phrase reasonable accommodation. The employer may become aware of the request as a result of the manner in which the discussion goes. So as a best practice, before instituting a mandatory vaccine policy, employers should provide managers, supervisors, and those responsible for implementing the policy with clear information about how to handle accommodation requests related to the policy.
And that's, very close to what it has always been. They don't have to say the magic words. There's not ADA accommodation. It's not a magic word. They have to say, hey, I can't get it because of my condition.
Right.
Things like that, that's enough. And then you're going to treat it as any other ADA request for a reasonable accommodation.
Right. So they don't mention ADA, but they say something else that invokes a disability, then that, in your mind as an employer, it triggers the analysis. What to do when an employee informs an employer that they are not getting the COVID vaccine because of disability? Now, following that, the next step is engage in a flexible, interactive process to identify workplace accommodation options that do not impose an undue hardship on the employer. You may have heard of this interactive process under the ADA when you're dealing with disabilities not related to COVID-19. Similar concept of the interactive process applies in COVID-19.
Yeah, and again, same thing. You may actually have to get supporting medical documentation. Everybody is, a lot of you have seen the ADA interactive process forms to get some kind of backup. Now, you're not going to ask them their medical history. You're not going to ask them exactly what the disability is, but why you are allowed to get some medical documentation as to what exactly is preventing them from getting the shot. And what exactly is not the diagnosis, it is why they cannot get the shot and why that's a problem for them. So it's a fine line, but some medical documentation is allowed to be sought. You cannot go too far. Again, cannot get their 10-year medical history, but a doctor's affirmation saying, hey, they have a medical issue that does not allow them to get the COVID-19 vaccine should suffice.
Yeah, and there are forms. There's ADA-related forms out there that HR can help you with, Regis can help you with, that exist, that provide guidance on how to do it by not crossing the line on asking for medical information. The ADA requires that employers offer an available accommodation if one exists that do not pose an undue hardship, meaning a significant difficulty or expense. This is obviously an analysis that the employee may try and hang their hat on. If in fact there is not a significant difficulty or expense, they may try and hang their hat that there is no undue hardship and therefore the accommodation shouldn't be provided. So employers are advised to consider all the options before denying an accommodation request. The proportion of employees in the workplace who are already partially or fully vaccinated against COVID-19, and the extent of the employee contact with non-employees who may be ineligible for a vaccination or whose vaccination status may be unknown. That can impact the ADA undue hardship consideration.
Yeah, again, blanket policies are not, inflexible blanket policies are tough to defend. Example again, the gardener who's outside the whole time has no contact with anybody else. You're gonna be hard pressed if he says, I can't get it because of my weakened immune system. You're gonna be hard pressed to say, well, if you can't get it, then too bad, you have to go. It would be an easy accommodation. He's not around people. He can get past. He doesn't have to interact. It seems like that would be an easy accommodation that again should be granted, and he should get that. He should get that break because of the ADA.
And under the ADA, be mindful, it's unlawful for an employer to disclose that an employee is receiving a reasonable accommodation or to retaliate against an employee for requesting an accommodation. That obviously is something that is not unexpected. Yeah,
and that retaliation, even if the accommodation is denied, you shouldn't retaliate for somebody for even asking. Even if their request is so far-fetched, it doesn't seem plausible. They still should not be retaliated against simply for making that request.
So now let's segue into employer-administered vaccinations and some issues that arise as a result of this. Do the ADA restrictions on an employer making disability-related inquiries or medical examinations of its employees apply to any part of the vaccination process?
And this simply is when the employer itself is the one administering the vaccine.
That's right.
I'm assuming most of you all probably would not administer vaccines to your own employees. This probably happens more in the healthcare field and some other ones. This likely does not apply to all of you, but it does raise several questions about the process.
That's right.
And one of the main things is, hey, there are questions that a doctor may ask you before you're basically get the vaccine. And it may be, hey, do you have any allergies? Do you have problems, immune problems, things of that nature? All of those, possibly, if you are the employer, could be covered and protected and should not be asked. So it's a very fine line that employers who want to administer the vaccines have to walk. So you have to be careful. Already they have said that yes, you can administer the vaccines, but you have to be very careful when you're asking these questions and not basically try and elicit information that is beyond the scope of whether or not you're getting vaccinated.
And an agent of an employer is any individual or entity having the authority to act on behalf of or at the direction of the employer.
Yeah, even if it's not, your manager administering the vaccine, if they bring in a nurse, but it's basically under the guise of the company, that still applies.
So the ADA generally restricts when employers may require medical examinations, procedures, or tests, for instance, that seek information about an individual's physical or mental impairments or health, or make disability-related inquiries. Disability-related inquiries dealing with questions that are likely to elicit information about an individual's disability. The act of administering the vaccine is not a medical examination under the ADA because it does not seek information about the employee's physical or mental health. Okay.
Yeah, so, but because of pre-vaccination screening questions are likely to elicit information about disabilities we talked about, the ADA requires that they must be job-related and consistent with business necessity when an employer or its agent administers the vaccine. So it's a pretty easy standard to meet now, but again, there are a lot of pitfalls. This COVID-19 vaccine and the COVID-19 disease itself has spread pretty much almost nationwide. You're going to be very hard pressed to find that it doesn't meet a business objective, but the CDC still has this requirement. And again, it's a requirement that's been around forever that has to meet basically, they have to have a reasonable belief based on objective evidence that an employee who does not answer questions and will pose a direct threat. So if they refuse to answer any questions, these pre-injection questions, you have to think that, hey, they're going to pose a direct threat, and we have to take them out.
Yeah, and the threat is to themselves or to the health and safety of others in the workplace.
Yeah, it's a tough standard. We wouldn't recommend, especially small employers, to try and go ahead and undertake this themselves, requiring vaccines and actually administering vaccines to their employees. But some employers have taken that step. Again, mostly healthcare, but it is a minefield.
Okay, if the employer offers to vaccinate its employees on a voluntary basis, meaning that the employees can choose whether or not to get the COVID-19 vaccine from the employer's agent, the employer does not have to show that the pre-vaccination screening questions are job-related and consistent with business necessity. However, the employee's decision to answer the questions must be voluntary. So the ADA does prohibit taking an adverse action against an employee, including harassing the employee or refusing to participate in a voluntary employer-administrated vaccination program. So and also, not surprisingly, the employer must also keep any medical information it obtains from any voluntary vaccination program confidential. So this voluntariness of it makes a big difference here. What should an employer do? Fully vaccinated individuals who request accommodations. A fully vaccinated employee may request an accommodation, and because of a continuing concern that they face a heightened risk of severe illness from a COVID-19 infection despite being vaccinated. Not surprising, you're going to see that now a lot with the Delta variant. So employers who do receive a reasonable accommodation request for employees should process this request. And as we spoke about earlier, there are specific ADA standards. Follow the ADA standards. When an employee asks for a reasonable accommodation, this is when the employer engages in the interactive process to determine first if there's a disability-related need for a reasonable accommodation. This process typically includes seeking information from the employee's healthcare provider with the employee's consent, explaining why an accommodation is needed. And you'll see this a lot with ADA-related forms, with HR. This is where Regis plays a very helpful part here, is getting the forms to the employee to get to their medical provider. And those forms have a very vetted out scope so that it doesn't go too far.
Yeah, and this, you all are going to start to see this more, that even if somebody's fully vaccinated, they say, hey, I'm scared of other employees cashing it and giving it to me. I don't want to be there. It's not going to happen with a religious accommodation because, again, they're already vaccinated at this point. So it's not really a reason. But under the ADA, if they are maybe immunocompromised or something of that nature, similar to what we saw before the vaccines were available, they may request these accommodations. And frankly, you treat it like you would any other request for accommodation. You try and get paperwork and you see what you can do. If there's anything to do, if it causes you an undue hardship, you may not need to accommodate.
So employer incentives. We're almost concluding here. We're getting to some of the final topics. Can an employer offer incentives under the ADA? Yes. Requesting documentation or other confirmation showing that an employee received a COVID-19 vaccination in the community is not a disability-related inquiry covered by the ADA. Therefore, you as an employer may offer an incentive to employees to voluntarily provide documentation or other confirmation of a vaccination received in the community. As noted before, the employer is required to keep the vaccination information confidential pursuant to the ADA. Notice in this slide, we're dealing with voluntarily providing documentation. Can an employer offer incentives for vaccines administered by the ADA? Yes, if an incentive, which includes both rewards and penalties, this is another factor, is not so substantial as to be coercive. Because vaccinations require employees to answer pre-vaccination disability-related screening questions, a very large incentive could make the employee feel pressured. This is that term of art, coerced, to disclose protected medical information. So it's got to be a very balanced situation and not be so overextensive.
And this goes back again to these employer-administered vaccines. There's a fine line. We said earlier, if you're going to require the employer-administered vaccines, it's tough. If they're optional, there's a little bit more flexibility. Here we go again. If they're incentives, yes, you're allowed to do it. But if they become so substantial as to be coercive, meaning, hey, you get 20% of your salary cut if you don't get the employer-administered vaccine, it's going to look not optional anymore. It's going to look like required and be
punitive. In that situation, punitive.
So they don't want to see that.
So this incentive limitation does not apply if an employer offers an incentive to employees to voluntarily provide documentation or other confirmation that they received the COVID-19 vaccination on their own from a third-party provider that is not their employer or an agent of their employer. So that's another consideration is will a third party actually be administered?
Yeah, again, I think the best practices is likely not for the employer themselves to be granting these vaccines just because there's so many pitfalls, but incentives are allowed. If you go get it from a third party, just bring us your vaccine card, or even honor system, frankly, can still work. Just let us know when you did it and we can administer these incentives.
All right, so can you offer incentives for vaccines administered by the employer under GINA, which protects, of course, against genetic discrimination type matters, et cetera? Yes, under GINA, as long as an employer does not acquire genetic information while administering the vaccine, employers may offer incentives to employees for getting vaccinated. Now, because the pre-vaccination medical screening questions for the 3 vaccines now available do not inquire about genetic information, employers may offer incentives to their employees for getting vaccinated. So under GINA, that is some good news. So can employers offer vaccines administered by the employer to family members of employees under GINA? No. Under GINA's Title II Health and Genetic Services provision, an employer may not offer any incentives to an employee in exchange for a family member's receipt of a vaccination from an employer or its agent.
And this is kind of a fine point, but basically, if the employer is the one giving the vaccines, they can't give you an incentive to get your family vaccinated under the employer plan. So it's a very fine distinction, and again, happens more when the employer itself is trying to administer vaccines. Even if they bring a third party, it's still the employer administering.
And the problem is it requires a vaccinator to ask family members the pre-vaccination medical screening questions, which include medical questions about the family member. Asking these medical questions would lead to the employee's receipt of genetic information in the form of family medical history of the employee. So you can see where this problem is going with this. Okay. Can the employers offer to administer vaccines to the employee's family members without incentives under GINA? Yes. GINA permits an employer to offer vaccinations to an employee's family members if it takes certain steps to comply with GINA. Employers must not require employees to have their family members get vaccinated and must not penalize employees if their family members decide not to get vaccinated. So a very, very interesting standard here. Now, you must also ensure that the medical information during the screening process is only used for purposes of providing the vaccination, that all is kept confidential. It's not provided to any managers, supervisors, or others who make employment decisions for the employees. So important restrictions to read there. Employers also need to ensure that they obtain prior knowing, voluntary, and written authorization from the family member. Get the consent before the family member is asked any questions about his or her medical conditions. If these requirements are met, GINA in this situation permits the collection of genetic information. That is it. We got a lot done within this hour. I hope that answered a lot of your questions, but I'm going to turn it back to George, and we're ready to talk about the question and answer, enter into the question and answer session. If you are, George, unless you want to make a few comments.
No, Zupi, I think that was great. Thank you so much. I think
You're welcome.
Can you guys hear me? Yep.
Yep.
I think we can go ahead and move into the Q&A. There's a few questions in the chat room, and I do know that there was a couple of people that mentioned in the messages that they needed to log off. And if you need to do that, go ahead, and we will email the presentation as soon as it's available on the cloud. But yeah, let's go ahead and jump right into the Q&A.
Great. So let's go to the chat room. Hold on, we're navigating into it now. Just 1 second. Hold on. I'm trying to get in there. There it is, chat. Okay. First question. What changes, if any, are there regarding COVID pay for employee absences? Does an employee qualify for COVID pay due to post-vaccination symptoms?
The short answer is there haven't really been any changes. The FFCRA type of leave is still available. At this point, it's not required. Employees do not have a right to it. It becomes an optional thing for employers, although they still can get the credit back for up to those 2 weeks. And yes, it does cover post-vaccination symptoms. So that is part of the one of the enumerated categories. So yes, they can, and it's to either get the vaccine or post-vaccination symptoms. So yes, that is covered. Although, as we noted, it's optional right now for employers. They don't have to. They're not required to give it, but they do get that credit back from the federal government for pretty much the entire, up to a certain limit, the entire pay of that employee for that time.
Okay, next question. Why, if they do not have a real reason for not getting vaccine? I think that probably meant to say, what if they do not have a real reason for not getting the vaccine? Well, as stated earlier, despite DeSantis' order, there is nothing out there prohibiting employers from mandating the vaccine amongst employees. However, there are certain caveats that employers should be mindful of, and we went through these earlier, and that is if there's a disability, if there's a pregnancy, if there's a sincerely held religious belief. So the answer to your question is if there's no real reason, if there's no disability, if there's no sincerely held religious belief, if there's not a pregnancy-related situation that would invoke the analysis allowing for a reasonable accommodation, then the answer is no, that's not sufficient. An employer, that's not a sufficient basis if the employer mandates it. So there are defined caveats that have been the focus of this presentation, and those are the exceptions that the analysis that the employer should take is if you're not going to take a vaccine, then you go down to disability, the Title VII, the ADA, all of that sincerely held religious belief analysis under Title VII, all of that analysis we just went through. For someone just to say, I don't want to do it, I don't really have a real reason, there's not been a rule come down from DeSantis or the executive, any executive order that prohibits employers from mandating it except in those situations.
Yeah.
Such as disability, and we mentioned earlier.
And remember, that is basically a rule that would, there's no rule that would require employers to allow employees, and conversely, to fire employees for not getting the vaccine. So the employer still has flexibility. The employer can make a reasonable accommodation with or without, some kind of ADA condition. You want to be careful not to treat everybody equally. So you don't want a disparate treatment argument. If you let one guy stay or work remotely and then decide not to, give the same accommodation to somebody else, even though neither of them have that disability. If one is a protected class and the other is not, there are those chances. So there's no requirement that, for example, you terminate an employee for refusing to get the vaccine, even though they don't have any of those particular basis. You could still accommodate them. You can still say, hey, okay, fine, you can work from home. Be careful, apply it evenly. By the same token, you can say, you know what? You don't want to get it. You don't have any protected reason why you don't have to get it. Technically, they can be terminated at that point. You can say, well, if you don't want to get it, then too bad, so sad.
So where we're going to start seeing possibly another slew of litigation against employers or claims against employers is what Joe's talking about, disparate treatment. So if a situation is done and you've properly vetted this and you ultimately terminate because they don't fall within a disability, they're not an accepted class, they may still file a claim, and they may claim that it's temporal proximity, it's too close in time, that this is an adverse action, and therefore file a claim based on disparate treatment or discrimination. So the recommendation is that every step of the way, work with HR in documenting your assessment, because ultimately, even if you make the conclusion that this person is just giving a discretionary, a non-qualified or non-acceptable reason for not getting vaccinated, you want to make sure that you've properly assessed it internally and documented it so that later on they can't come back and say, well, you discriminated against me, disparate treatment, you treated me differently than other employees. You want to apply your policies uniformly. You want to document how you do things. You want to accommodate if there's a disability, accommodate situations if there's a sincerely held religious belief, so you don't get in trouble in those categories. And if you satisfy those categories, apply things equally, apply things in a uniform fashion so that there's not this disparate impact that comes up. Because the moment you terminate, it's an adverse action. And where we see the plaintiff's bar going is trying to show that there was retaliatory conduct and a wrongful termination. So the more you can document and follow the principles that the CDC, the EEOC provide, that's great. Even though a lot of the CDC's guidance, it is guidance, there's no law out there, the CDC guidance is helpful. The EEOC and DOL's guidance is helpful, and at least that's some level of guidance out there that employers can, follow. It may not be bulletproof because each case is unique, but documenting how you did it and why you did it is important.
Yeah, and again, going back to the documenting, if you decide, okay, I'm going to let that gardener work, even though he doesn't have a basic ADA or Title VII protected reason not to have the vaccine, but I'm going to let him work because he's not around anybody all day long. So, we care for our employees and we're going to let him stay and tell him, if you come inside, you have to wear a mask or stay outside generally, give him some guidelines. It's going to be a lot easier to prove your case that if the next person who comes in who works in densely populated area with several employees, if you have to terminate them because they don't have a valid reason either, it's going to show why one was allowed to stay and the other one's not. So you're going to show that, hey, it's not just because of a protected class. We actually looked at this, we took time, we looked at this, and we decided, hey, because of where you work, it was a lot easier to say, okay, you can stay around while this other person was in a very dense situation, lots of people around. We do not want to take that chance. So,
Okay, great. Final question I see on the screen is, how does requiring a vaccine apply to 1099 employees? Okay, well, I think what that question meant to say is contractors, 1099 employees, or W-2 employees are employees, 1099 deals more with an independent contractor, et cetera. So I think in the end, first and foremost, you want to classify your team correctly. You can work with HR, you can work in understanding the job descriptions, whether they're W-2 or 1099. They're 1099, then, and they're contractors, it's not the same thing as an employee. However, because of the fact that it may raise an issue of misclassification, these individuals that are 1099 may come back if they work intimately with your team and say, I'm part of the workforce, I'm part of the workforce. Whether or not there's a misclassification, it's still standard good practice that if these individuals are working in your workplace setting, that you not ignore this guidance out there from the CDC and the DOL.
yeah, and I don't think anybody would imagine a contractor would be considered a patron or customer. So you're pretty safe in following the same general guidelines. Although as Carlos pointed out, you want to be very careful. You don't want to call your 1099 contractors employees
right?
for a variety of reasons. But treating those people that work for you on a contract basis or some other kind of basis equally, maybe requiring vaccines, you should probably follow these type of rules for contractors. For employees. So follow a similar kind of pattern. But again, I'm worried about the 1099 employees. That term alone raises a whole mess of other issues that you want to be careful of.
Yeah, and I think in the end, it's customers and patrons is what they have come up. Your workforce and your employees, this guidance that has come out there is from the EOC and the CDC is very, very telling. Florida follows this guidance, which is very, very helpful. It remains to be seen. It is possible that the governor or Florida deviates gets into some future executive orders that are a bit more specific. But in the end, you have a lot of tools, and at least the good news is from a simplicity standpoint, Florida, it does follow the federal level. And also check your local jurisdiction, because you may be in a part of Florida that has a specific nuance to what's going on that doesn't apply in Dade County, for instance. So it's important to work with your team, to work with legal and say, look, I may work in the Panhandle, or I may work, on the West Coast. Is there anything specific to that county that could be different or problematic and so forth?
Yeah, and I see you corrected that. Yeah, it is a contractor, a maintenance worker. Generally, we should probably try and, I don't know if it's a maintenance worker that is coming in to your office, or if it is somebody contracted through you to work at other offices. But I would assume that contractors are going to try and follow the rules that are set up to them with their contract parties. So I don't see a problem in enforcing it. Again, governor's order, I don't think would ever apply to them, because they're not patrons and not customers in that sense of the word. So I think you're safe there. So possibility of requiring vaccines, I think so. Other factors, requiring face masks, things of that nature, should be acceptable. Again, it may be governed somewhat by the contract that they have, but it appears that, yes, you can go ahead and require similar things to your employees, i.e. vaccinations or preventive measures, social distancing, things of that nature.
Yeah, but you can't, what you can't do is, because you're not their employer, is if you have a contractor that contracts with you and they have a separate employment team, your relationship with that contractor, you all can set up the parameters, but that individual governs the employment relationship of their own employees, because they're not employed by you. So you may have a contract with that individual or that other entity that governs your relationship, but I doubt that contractor is going to allow you to go into and govern how he runs his business. So what probably should happen is you should have clarity between the two from a big picture standpoint, have clarity. Obviously, don't get into any personal or medical related inquiries or anything about this individual's employees and so forth. But your relationship by contract with a contractor who hires people is obviously very different because you're not the employer of those employees, then you're direct employees or your workforce that works on site for you. Okay, I don't see any more questions, so I want to thank Regis. I want to thank Carlos Saladrigas, George Saladrigas, the entire Regis HR team. We can't thank you enough. You all, again, another productive session, and thank you all for attending. We are always encouraged when I see employers, and so many employers like this participate in this. So I want to thank again Regis HR, and I'm going to turn it back to George.
Thank you, Carlos. Thank you, Joe. I really appreciate it. As always, extremely informative. As I've mentioned several times, we will go ahead and share a link to the cloud recording as soon as it's available from Zoom. We will send that out through our newsletter. As always, please remember that you have your HR representatives to reach out to if you have any questions. And thank you everyone for joining. I really appreciate your time. And you know, as the need arises, we will continue to do these in the future to stay on top of this ever-changing world. So again, my sincere thank you, and my brother's apologies for not being able to be here again. But we'll see you on the next one. Thank you so much.
Thank you very much.
Thank you all.
Thank you.
Bye-bye.